The human brain. It is the most complex structure known to humankind. For neurosurgeons, it is not merely an organ, but a sacred landscape they are entrusted to navigate. It is a world of intricate pathways, delicate tissues, and the very essence of what makes us human. To embark on the journey of neurosurgery is to commit to a lifetime of learning, of understanding the brain in all its wonder and fragility. Neurosurgeons hold a unique position in the medical world. They delve into the very core of human consciousness. They operate on the organ that dictates our thoughts, movements, emotions, and very sense of self. This privilege comes with an immense responsibility. It demands a deep understanding of the brain's anatomy, its physiology, and the intricate ways it can be affected by disease. The journey begins with a profound respect for the brain's complexity. It requires a thirst for knowledge that never truly ends. Every patient, every procedure offers a new opportunity to learn, to refine skills, and to marvel at the brain's resilience. This essay delves into the essential knowledge a neurosurgeon must possess. It explores the core principles that guide their practice and the compassionate approach needed when navigating the delicate landscape of the human brain. For in the hands of a skilled and empathetic neurosurgeon, there lies the potential not just to treat, but to heal, to restore, and to offer hope in the face of extraordinary challenges. Imagine a cartographer meticulously mapping a vast and intricate world. Every mountain, river, and valley must be precisely charted to create an accurate representation. This is the task of a neurosurgeon, whose map is the human brain, a complex and mysterious landscape that requires a deep and nuanced understanding. Their map being the human brain, a structure so intricate that even the smallest error can have significant consequences. A deep understanding of neuroanatomy is not just foundational. It is paramount to every decision made, every incision placed. This knowledge forms the bedrock of their practice, guiding them through the most challenging procedures. The brain is not a homogeneous mass. It is a highly organized structure, with each region playing a critical role in our daily lives. It is a tapestry of interconnected regions, each with its own specialized function. These regions work in harmony, allowing us to think, feel, and move. The frontal lobe, the seat of our higher cognitive abilities, is responsible for decision-making, problem-solving, and controlling our behavior. The parietal lobe, processing sensory information, helps us understand our environment and navigate through it. The temporal lobe, responsible for memory and language, allows us to communicate and recall past experiences. The occipital lobe, dedicated to vision, processes visual information from the eyes, enabling us to see and interpret the world around us. And nestled beneath the cerebellum, orchestrating movement and balance, ensures our movements are smooth and coordinated. A neurosurgeon must be intimately familiar with these regions, their boundaries, and their interconnectedness. This knowledge allows them to plan and execute surgeries with precision. They must be able to visualize the pathways of critical nerves and blood vessels, understanding how they interact and influence each other. This knowledge is not static, it is dynamic and ever-evolving. Neurosurgeons must stay abreast of the latest research and advancements in the field. New discoveries about brain structure and function are constantly emerging, demanding continuous learning and adaptation. This ongoing education is crucial for providing the best possible care to patients. Just as a cartographer relies on precise measurements and coordinates, a neurosurgeon depends on sophisticated imaging techniques like MRI and CT scans. These tools offer a window into the brain's intricate landscape. These tools provide detailed maps of the brain's landscape, guiding the surgeon through its intricate terrain. They reveal the brain's structure in remarkable detail, highlighting areas that require special attention. With each image, the neurosurgeon gains a deeper understanding of their patient's unique anatomy, allowing for personalized treatment plans and surgical approaches. This individualized approach is key to achieving the best outcomes. In the operating room, this anatomical knowledge becomes the surgeon's compass, guiding their every move with precision and confidence. It helps them navigate the brain's delicate structures with care. It allows them to navigate the brain's delicate structures, minimizing the risk of damaging vital areas and maximizing the potential for successful outcomes. This precision is what makes neurosurgery both an art and a science, requiring a blend of technical skill and deep anatomical knowledge. The human brain is a marvel of nature, a complex and intricate organ that has fascinated scientists and doctors for centuries. It's a complex organ responsible for everything that makes us human, from our thoughts and emotions to our movements and sensations. Understanding its healthy state is paramount for a neurosurgeon, as it provides the baseline against which all abnormalities are measured. But equally crucial is the ability to recognize and interpret the language of disease, a skill that can mean the difference between life and death. The brain, when ravaged by illness or injury, speaks a different language, one that requires a trained eye to decipher. It whispers its suffering through subtle changes in texture, color, and vascularity, each alteration a clue to the underlying pathology. A healthy brain pulsates with life, its rhythmic movements a testament to its vitality and function. Its surface is smooth, glistening with cerebrospinal fluid, which cushions and protects it from injury. Blood vessels, like delicate threads, weave through its surface, delivering oxygen and nutrients essential for its function. The tissues themselves, ranging from the greyish-white matter to the darker nuclei, have a distinct firmness and elasticity, each type playing a unique role in brain function. Contrast this with a brain under siege, where the once harmonious structure is disrupted by disease. A tumour, depending on its type, might appear as an irregular mass, distorting the brain's natural contours and disrupting its blood supply, leading to a cascade of complications. A stroke can leave behind a softened, discoloured area, starved of oxygen and irreversibly damaged, its once vibrant tissue now a shadow of its former self. Infections can cause swelling and inflammation, turning the brain's protective fluid cloudy and thick, a sign of the body's battle against invading pathogens. Recognizing these telltale signs of pathology is a critical skill for a neurosurgeon, one that requires years of training and experience. It allows them to differentiate between healthy and diseased tissue, to assess the extent of damage, and to make informed decisions about the best course of treatment, tailored to each patient's unique condition. This ability to read the brain's subtle cues often means the difference between a life saved and a life forever altered, highlighting the importance of precision and expertise in neurosurgery. Furthermore, understanding the specific ways in which different diseases manifest in the brain is key to developing targeted therapies, which can improve outcomes and quality of life for patients. It informs the surgeon's choice of instruments, the approach to surgery, and the post-operative care plan, ensuring that each step is optimized for the best possible result. In the delicate dance between preserving healthy tissue and addressing the diseased, this knowledge is the neurosurgeon's most valuable tool, guiding their hands and decisions in the operating room. The human brain is a symphony of electrical and chemical signals, a marvel of biological engineering that orchestrates our every thought, action, and sensation. It's a network of billions of neurons communicating with each other, each one sending and receiving messages at incredible speeds. This intricate communication network underpins every thought, every action, and every sensation, creating the rich tapestry of human experience. For neurosurgeons, understanding this intricate language of the brain is not just an academic exercise. It's a matter of life and death, a critical component of their daily practice. The stakes are incredibly high, as even the smallest error can have profound consequences. Each region of the brain, from the motor cortex controlling movement to the visual cortex processing site, plays a unique and vital role in this grand orchestra. These regions communicate through a complex system of interconnected pathways, some short and direct, others long and winding, each one essential for proper brain function. These pathways are like the brain's wiring, transmitting information at lightning speed, ensuring that every part of the brain can communicate effectively with every other part. This rapid transmission is crucial for everything from basic motor functions to complex cognitive processes. Surgery on the brain disrupts this delicate communication network, posing significant challenges for neurosurgeons. Incisions, however precise, inevitably sever some of these connections, making it essential to plan each step meticulously. The impact of such disruptions can be profound, leading to temporary or even permanent neurological deficits, affecting the patient's quality of life. These deficits can range from minor inconveniences to major impairments, depending on the location and extent of the disruption. Therefore, a neurosurgeon must possess a deep understanding of these neural pathways, knowing exactly which areas to avoid and which can be safely navigated. They must be able to anticipate how surgical interventions might affect these connections and take steps to minimize any potential damage, ensuring the best possible outcome for the patient. This involves careful planning and the use of advanced imaging techniques to map out critical pathways beforehand. These imaging techniques allow surgeons to see the brain in incredible detail, identifying the safest routes for their surgical instruments. It might mean carefully choosing incision sites to avoid disrupting vital areas, ensuring that the most important connections remain intact. Moreover, neurosurgeons are increasingly using techniques that work in concert with the brain's natural communication systems, enhancing their ability to perform delicate operations. Deep brain stimulation, for example, involves implanting electrodes that deliver electrical impulses to specific brain regions, modulating neuronal activity to treat conditions like Parkinson's disease and other neurological disorders. This technique has revolutionized the treatment of certain conditions, offering new hope to patients who previously had few options. In essence, a neurosurgeon must become fluent in the language of the brain, able to decipher its signals and understand its complex circuitry. They must be able to decipher its signals, understand its circuitry, and respect the delicate balance of its communication network, ensuring that their interventions do more good than harm. This delicate balance is what makes brain surgery so challenging and so rewarding, as each successful operation can dramatically improve a patient's life. This knowledge, combined with surgical skill, is what allows them to intervene with precision, minimizing risks and maximizing the potential for positive outcomes. The precision required in brain surgery cannot be overstated, as even the smallest mistake can have significant consequences. But with the right knowledge, tools, and techniques, neurosurgeons can achieve remarkable results, helping patients recover and regain their quality